The Nigerian government has been called upon to do more in terms of emergency health preparedness in the fight against outbreak of diseases so as to save lives from the spread of communicable diseases. This was the thrust of discussion at a press conference where the Board of Fellows of the Pharmaceutical Society of Nigeria announced its proposed public lecture with the theme Policy Framework for National Development Amidst Current Global Challenges, whither Nigeria. The Chairman Planning Committee of the Board of Fellows, Lekon Asuni, explained that Nigeria still has a long way to go in the fight against the outbreaks of diseases.
But in terms of a national preparedness plan, I think I see a huge gap for us to be able to put in place a very good framework that helps us to track when this will happen, when it happens, what we should do, and what other aspects within the addressing that problem that actually need to be in place, research and development, making drugs available and all that.
The Chairman, Board of Fellows, Professor Femi Oyewo, noted that pharmacists are custodians of medicines which include vaccines, so it is necessary to checkmate the menace of drug abuse and the fight against open drug markets.
We are also on the front line. The front line. Because when you are not feeling a little bit, you're feeling a little bit down, your first point of call will be your pharmacy. Because you remember at the COVID, the peak of COVID, everybody was afraid of going to the hospital for any other sickness. Nobody wanted to. You'd rather go to the pharmacy, get whatever. So pharmacists were also at the front line. We were doing what we could. And at every level of the state, I told you that all the various technical groups, the interest groups, the various arms, including even in the Young Pharmacists group, they were all doing what they called donating, making sanitizer, hand sanitizers, and donating to the various agencies, the government agencies, the hospitals, even the faculties of pharmacies. NGOs. Yes, the NGOs. The faculties of pharmacies also started making hand sanitizers for the university communities because you couldn't get them to buy. And they were beyond the price. You had to make them for the university community to safeguard the people in the universities. So pharmacy has actually risen to the occasion.
The Board of Fellows was founded in 1972 with an initial member of 20. The founding fathers designed a body of men and women of distinction and integrity that will interface with policy makers for the advancement of the pharmacy profession. The virtual public lecture will hold on Saturday, 19th of September on all social media handles at Board of Fellows _PSN.